All right, so thank you again, Carolyn. I appreciate it. I just wanted to start out by introducing myself again. My name is Melissa Bloomer. I am a physical therapist as well as the director of rehab at Louisa Physical Therapy. I've been living in Virginia since 2005. I started working in Charlottesville for 2 years and then ended up finding this little group out in Louisa, which I sort of have fallen in love with. So I usually am commuting back and forth an hour from Charlottesville out to Louisa until the pandemic hit. During that time, our office actually shut down for a couple of months. And slowly we started getting more and more patients that wanted to come out to the clinic. However, we also had a lot of people who were interested in telehealth. Being in a very small rural clinic that's a private practice, we did not have any of our forms digitized. We didn't have any of the technology to utilize for telehealth. So during the last few months, what I have been doing is getting ready, taking continuing education classes and learning how to do this. Our program launched just at the end of July. So I am new to telehealth, and as Carolyn had said, I'm just interested in trying to help people to understand a little bit more on how it works, answer any questions that you have, and also just to give a little bit of history about telehealth. So this presentation is just going to be, a small presentation, just basically going through that. And then I'd love to open it up and ask, anybody can ask questions or also give any comments on how they have utilized telehealth up until this point. History and the current climate of telehealth services. Telehealth has been used for many years, mostly for military operations, veterans affairs, private pay, and rural areas. It has actually been around for quite a few years. Due to the current COVID-19 pandemic, I think the thing that has catalyzed the majority of use of telehealth is that insurances are now covering it. They are realizing that this is a safe mode of healthcare that people can utilize. So starting, I believe it was in April, Medicare opened up and said that they were going to cover telehealth visits. And quickly, the majority of the other commercial insurances, Humana's, a lot of the different insurances decided that they would cover it as well. Just in the last couple of months of utilizing telehealth, we've also found that they're actually giving incentives for a lot of people to utilize telehealth. A lot of the Anthem policies, Humana policies are waiving copays. Like if you had a $25 copay to come into the clinic, they're also waiving copays to utilize telehealth. So we're finding that a lot more people are willing to try it as well because of that. Current trends in the United States. New research is currently showing an increase in deaths due to heart disease, stroke, and diabetes since the pandemic has hit. Emergency room visits have declined for the above diagnoses, and research has indicated that people are afraid to go into the hospital or maybe don't want to go into the hospital to increase the burden of the burden of staff, which is quite concerning. Obviously, with COVID-19, we don't want people to get COVID-19. However, we also want people to maintain their health during the pandemic. So that is definitely a concerning statistic. From March 1st through April 18th, which of course was at the very beginning of COVID-19 hitting the United States, the mean weekly number of newly diagnosed cancer patients decreased 46.4% for breast, colorectal, gastric, pancreatic, and esophageal cancer. This was recorded according to the Cancer Research Network, which is an electronic medical record analysis. So they were taking a look to see, what reports of what has been statistically diagnosed. Since that time, it's slightly improving because I think people are starting to slowly go back into hospital settings and screening centers. However, that number is still declined compared to what it normally would be for any type of mammograms, colonoscopies, anything that would normally be screened. As far as some pros of telehealth, one big thing is that it's very convenient and time saving. Instead of having to get in the car and drive somewhere, you can be at in your own home and press a button and be in contact with a person. The biggest thing right now, which I find is definitely a pro, is it's decreasing the risk of exposure of illness. If you go and sit in a waiting room at a doctor's office, even if you have a mask on, it definitely is at more of a risk than being at your home without being in contact with anybody. It's also very cost effective, as far as even from the clinician side, we don't have to use the cost of PPE, support staff as much. You don't have to have people checking into a clinic. Rural areas can reach specialist care, which that is a big problem. A lot of people have to drive, quite a ways in order to get a specialist appointment. Again, if they do have internet access, they can reach specialists a lot easier. Remote monitoring, which again, remote monitoring of patients has occurred prior to COVID, but it is so even more now. There are different ways that they can give people remote monitoring equipment, such as blood pressure monitors. They can report blood sugar levels. People can touch base by video after somebody has had a hospitalization. There's a decrease in no-shows and cancellations. It's a lot easier if, somebody comes, has missed an appointment, to zip on the phone and say, hey, it's time to get on, your computer for your appointment. And like I said before, this really does open up our, having issues with a lot of people getting protective equipment. I know that our clinic has, even just getting cleaning supplies, masks, all the things that are necessary right now due to COVID-19, treating some patients remotely certainly decreases the burden of that. Cons of telehealth: people who do not have access to technology cannot have access to services. We do notice that, especially out into the rural areas where I service patients out in Louisa. A lot of people do not have good internet access, and therefore they wouldn't be able to utilize these services. Lack of palpation and manual skills that could otherwise be used in person. As a physical therapist, of course, I use my hands like I use my eyes, and doing palpation and manual skills, as well as doing manual therapy on patients, is definitely something I cannot do through the screen. I wish I could take my hands and treat people, but that's not how it works. There are some cons, I would say, as far as security of healthcare information. Obviously, if you have things that are being stored on a computer, or just like we're talking on Zoom right now, there could be security violations if somebody decided to try to come in. We do always use, I use a system called Doxy, which is a HIPAA compliant, safe and secure website for visits, but a lot of people do feel more comfortable with Zoom. Which again, I highly doubt that a lot of people are going to be trying to get into a therapy visit where we're just doing exercises and things like that, but it could happen. And then I'd say another con is also the generational gaps of use of technology. Some people have never used these services. I think a lot of us, even myself, prior to COVID-19, we're not using video conferencing and a lot of these programs, although I think that a lot of things have been around for a long time, but just not utilized. Common questions about telehealth that I get when somebody is wanting to do telehealth, but they're not quite sure how to. One is, what do I need? What do I need in order to do it? And really, the biggest thing is an internet connection that will allow you to stream video, as well as a device that allows you to hear audio and stream video. So that's the best case scenario. I have had patients connect to me with a phone. That's worked fine. I've had people that have used computers, laptops, tablets. There are certain provisions. I know that Medicare has allowed phone visits occasionally. There's a lot of stipulations to that, whether or not the insurance will cover it. And basically what it entails is that we would have to document that you have no access because you're in a rural area to video. And we try to do visits synchronously, meaning that you and I would be talking on the screen at the same time together, and I could demonstrate something or you could do something for me. But there are asynchronous ways, meaning I could send a video of myself doing an exercise and email it to somebody and then they could access it. There are ways of doing that, but I think that you'll find in most realms currently that they do ask for, if possible, video and audio together. What does a telehealth visit look like? Well, since you can see me, this is a lot of what it does look like. So what we do is, we come in, we have an interview just like we would if you were in the office. We discuss what subjective information you have about, if you've had a recent diagnosis, if you've had an injury. There then becomes an objective portion, which of course does look different compared to what I was doing, in the physical therapy clinic. So for me to test somebody's leg strength, for instance, instead of me saying, okay, bring your hip up, don't let me push you down, and I'm testing different muscle groups, I might have to say, okay, can you stand up from your chair without using your hands? And that's how I'm documenting strength. Or can you go up on both of your toes so that you can lift your heels off the ground? Okay, can you do that with one foot? Can you go up and down stairs? Do you have to go one at a time, or can you go reciprocally? And so a lot of my documentation is based off of visual observation versus actually putting my hands on somebody and figuring things out. We also do look at range of motion. If I'm treating somebody's neck and they can only move this far, unfortunately, I don't have a measuring tool to say that. I'm having to estimate, okay, you can move your neck 45 degrees to right rotation or left rotation. So that's a little bit different, as far as how we're managing goals and things like that. There are times where I stand up, and if you can see behind me, this is my little physical therapy area. So sometimes I'll put the laptop on the floor, or I'll lay down and do an exercise to demonstrate for somebody, and then I will watch them. If somebody is by themselves at home, a lot of times I'll just have them prop me up somewhere. Like, okay, let's go in the kitchen, and you're going to hold on to your kitchen counter, and they'll take their device with them and prop me up somewhere so that I can see them. So there's a lot of talking involved and figuring out how, making sure somebody's safe and how they can do an exercise appropriately. Who is a good candidate for telehealth? I think the biggest thing that I'm finding is a person who is comfortable utilizing technology, or at least is willing to try, because there's a lot of people that I've treated that have never utilized this at all. But, between the two of us, I'm not an IT person, I'm a physical therapist, but I've been able to problem shoot a lot of different, ways to help people to get online and do what they need to do. They need to be cognitively able to follow directions, or have a caregiver that's able to help direct the treatment. If I have a patient that's cognitively not intact, or say they're impulsive, and then I get online with them and they're not safe, I obviously can't be there to hold on to them if they were to fall. They have to be somebody that recognizes their own boundaries as far as their balance deficits and that kind of thing. So I would say somebody who is generally safe in their home environment is something that I do look for. What if, this is a lot of people ask this, what if I try telehealth and it does not work well? This is really something that I think is a take-home message from today for me. This is a new technology for everybody, but I feel confident that myself as a physical therapist, as well as if you were, interacting with a doctor or anybody in the healthcare field, that we are trained to screen patients accordingly. It opens up a dialogue to review information with somebody. So if, for instance, somebody contacted me and they said, okay, this is what I'm noticing, this is what's going on. I've been a clinician for over 15 years. If I have a patient that I start seeing red flag symptoms on, or I think it's something that's not musculoskeletal, or it's something that's a new thing that hasn't been diagnosed properly, I'm going to talk to them about that, and I'm going to refer them back to their doctor, and I'm going to make sure that that person, does what they need to do. But if they didn't try therapy, they wouldn't have that access. And as a clinician, I will say that as a seasoned clinician in particular, over the years, if I hear the same thing like shoulder impingement and I hear the same cluster of symptoms over and over again, if I had somebody that, went to the doctor and they said, try some physical therapy, and I didn't think it was shoulder impingement, or I thought it was something that was concerning to me, I would know that just based off of a subjective exam. I think that the majority of clinicians, physicians, occupational therapists, physical therapists, we know what our boundaries are, and our goal is ultimately to keep you safe and to keep you healthy and to try to progress with treatment. If I was working with somebody and they weren't progressing, I would be trying to, assess whether or not they should be going into the clinic or following up with their doctor for further diagnostics. For clinical considerations for physical therapy, this is what I am finding. And again, I've only been doing this for a couple of months, but I'm starting to get a better sense of what I think works well for physical therapy. If somebody has a recent surgical intervention, so let's say somebody just had a total hip replacement or total knee replacement, or pretty much any surgical intervention where they have scar care, wound care, there's a lot that can happen with edema, swelling, decreased scar tissue mobility, that kind of thing. I really feel like those patients are going to do better in office versus telehealth. Now, once somebody is established, like I was just telling Carolyn, I had a patient for the last couple of weeks who, she had a total shoulder replacement. She'd been going to the clinic, I'd say for about 4 weeks. She was within her protocol and had a death in the family, and she had to go down to Florida and had some exposure that she was concerned about. We as well as the patient didn't want her to come back into the clinic for 2 weeks. So that patient would have been a patient that otherwise wouldn't have had care for 2 weeks, but instead we did some telehealth visits, and that worked well. I had her protocol. I spoke with the treating clinician in the clinic. She gave me all of her paperwork, and then I was able to, have that continuity of care. If somebody has a recent neurological diagnosis, I also would say that at least an evaluation in the clinic so that we could get your hands on that patient. There's a lot of neurological testing that I cannot do safely via telehealth, especially if I don't have somebody with that patient. I can't have them close their eyes and stand in space and I'm not there to grab them. And so for me to really give a true assessment for a recent neurological patient, I think having at least a few visits in the clinic would be great. I have had patients who've contacted me who, say they have a diagnosis of Parkinson's disease, and I've treated them for 3 or 4 years in the clinic intermittently, and they have a caregiver that I'm comfortable with and that I could take a look at the patient, and have the caregiver guard the patient while we're running through activities. I think I'd feel comfortable with that. But again, I would have to feel comfortable with the caregiver. Again, somebody who is having frequent falls or they have a decrease in their cognition. If I have a patient who I'm trying to help, get through treatment, and I can tell that they're unsafe, and I feel like I need to jump through the screen and hold on to them while they're doing activities, then I don't feel like they're a good telehealth candidate. I also think that there are some recent very acute injuries, whether or not people have very out of control swelling or that kind of thing, that if they felt comfortable to go into the clinic to utilize modalities and different things that we could do in the clinic, get them over that hump. And then once they're out of that really acute stage, that I could see them via telehealth. Again, that would have to be kind of a case by case basis, but that just gives you a little bit of an idea. So in conclusion, I would say that telehealth is a very safe technology to access healthcare. I feel like COVID-19 has catalyzed the use of this technology as well as helped insurances to cover it. I really feel like this could be something that once even the pandemic is done with, that we could continue to utilize in a way that it would give people better access to healthcare for all of the reasons that we've just talked about. People who are on here today who can get onto Zoom and that kind of, I probably am preaching to people who already can do these types of things. But please don't be afraid to try telehealth as part of your healthcare experience, because I do think that it really does have a place and can really be a valid part of your healthcare. But I also would say that if you have people who are on the fence about it, family members, other people within the community, and you notice that, you know, they're concerned about something, or they're hurting, or they have a recent diagnosis, or they're concerned about their health, but they are afraid to go into an outpatient clinical setting, I would just try to encourage those people as much as possible to try telehealth as a stepping stone to then get access, because I think that once they talk to their clinical staff, whether it be physicians, nurse practitioners, physical therapists, occupational therapists, and actually can get face-to-face, even if it's on the computer, that they could at least talk through what it would look like. Okay, let's see if we even got you in for some blood work, and you could do that in the parking lot, and then we could follow up by phone or by a telehealth visit, or you know, give somebody, okay, like you need, you know, I really think that you need to have your mammogram. You've had a history of, you know, having issues, but maybe you could get the first appointment of the day after a weekend, so there's not as many people into the outpatient clinic. But again, us clinicians, we have a lot of resources. We are doing a lot of reading on how to access healthcare at this point, and it's just a good access point if somebody is not taking good care of themselves during this time. These are just a couple of quick references from the statistics I used at the very beginning. And what I would love is, first of all, I'm open to any questions that anybody has. I also would love it if anybody has utilized telehealth in any way, if they'd be willing to share any experiences that they have.
Great. There you go. Perfect.
Okay. Actually, I'm a patient of Melissa's, and I love telehealth because I am about 45 minutes away from the clinic, and it's on country roads, and you can't always get there on time, although today I was late for another reason. But it's so very convenient. It's very convenient, and it's very easy to follow the directions that are given, and it's very easy to stand back far enough that she can make sure that I'm actually doing the things right. And I don't know that I ever, although I love Melissa and I love seeing her in person, I don't know that I ever need to do that unless unless I can get one of her wonderful massages. Then of course, and that was something I was wondering about. Can you do in-house and telehealth? Like, could I go to your clinic and get a massage once in a while?
Yeah.
Because of my neck and all, I would love to have somebody do that again.
Yes, and actually, thank you for talking, Janet. I appreciate it. Yes, we have had plenty of patients who've been utilizing going into the clinic and then coming to see me, and I think that probably is dependent upon, you know, each clinic and how they're set up, you know, but we are set up to do that. So it's very easy to, you know, I can give my recent notes and send it over to the clinic, and then they can see what we've been up to and then treat you for a visit. And then they just send that daily note back to me. I will say, and you know, just for people who are interested too, a lot of clinics right now, unfortunately, because of COVID guidelines, our manual therapy is quite limited. If it, you know, not saying that they don't do manual therapy, but a lot of the, you know, current treatments, if they're not, we try to maintain a 6-foot distance if possible, because the majority of clinics, you know, have so many of the high risk population coming in and out. So I know that our clinic, it's, you know, there are occasional times where people are coming in and doing manual work, but unfortunately right now what our normal clinic is looking like is not the usual. It's not the usual. But yes, Janet, I'm sure we could arrange that.
Because John tries, but he's just not very good
It's
at
not
it.
the same.
My
Yeah.
husband. Yeah. And also the same thing about the heated electronic stuff you used to do to my back.
Right, right. Yeah, and
I
again,
could do.
there's a lot of nice things in the clinic, you know, modalities that we use on a day-to-day basis that when we're in a virtual world, we can't utilize. And that is a restriction of telehealth.
Melissa,
Hi.
what service do you use? Zoom or some other special service? I think there are so many out there.
Yeah, so actually I'm currently using two. I do use Zoom because so many people are used to using Zoom. The American Physical Therapy Association has put out a statement, as well as Medicare and that kind of thing, that we can use Zoom currently for physical therapy. And it actually seems to connect better. It's easy to screen share, all these things that we can utilize with Zoom. The downside to Zoom is that it is not HIPAA compliant. You know, the free Zoom that people use is not HIPAA compliant, which means that there can be ways where people could be, just like right now, somebody could be spying on us as we're having this conversation. We definitely utilize password protection so that we make sure that the people who are being admitted are only the people that we, you know, have referenced for the visit. The other platform that I'm using is called Doxy. That is a HIPAA compliant platform. So Doxy it's kind of a website where I give you a link. I have a virtual waiting room. I send it to you in your email. You press on it at the time of the visit and you enter into my virtual waiting room and we press on it and it looks very much like this. So, you know, it's a video interface. That is HIPAA compliant. We have a BAA agreement with them, which is a business association agreement that allows them, basically it makes them liable for anything that could be leaked, you know, online of anything. I find with physical therapy that I feel comfortable utilizing Zoom. It tends to also connect better. It doesn't use as much internet bandwidth, so it doesn't freeze as much as Doxy. And that could just be a lot of the clients that I'm treating are out in Louisa County, which their internet isn't the best to start out with. And so I've had a couple of patients that I've started trying to use Doxy and then just show them how to use Zoom, and we've been utilizing Zoom.
Melissa, this is something I'm fascinated by. I'm fascinated by that this whole technology and the interface with patients can really revolutionize the whole healthcare business.
Yes.
I'm concerned about how do you incentivize healthcare professionals to begin to use this and promote it? Absolutely none of our healthcare providers have reached out with any of this at all.
Right.
And that, you know, that's a concern to me, because unless they take the first step, patients have a huge incentive to want to use this. As Janet mentioned, is that you don't have to drive 45 miles or 45 minutes to get to somebody. And so much of the interaction with our healthcare providers is, you know, simple questions and things like this. So how you know, what are the incentives? What were the incentives for you as a healthcare professional to begin to use this?
Right. I will say that I do feel like I'll tell you about our personal incentives, and that's the fact that our clients, our patients were constantly asking for it. It was not easy to set up, and the fact that there's a lot of legalities with it. Like I said, we had to digitize our forms. We had to be up and running. My self-motivation is, I have asthma, so going back into the clinic right now, I don't have childcare. I have a 6 and an 8-year-old at home. I don't know if I would have utilized this prior to the pandemic. But now that it's here and it's available, I think there's a few things. One is making sure people are aware of how to utilize it, just like we're doing here today. We're having conversations about it. We're trying to promote the use of it. I think that any chance that you can get, if you contact your doctor's office, you should ask. I would feel comfortable if I could have a telehealth visit. Do you offer that? Obviously, the more that they hear that, the more that patients will drive that as part of their, access to healthcare. Quite honestly, I think another big thing, the biggest thing is Medicare is covering it right now. The fact that Medicare is covering it, if I would have done this a year ago and Medicare wouldn't have covered it, I highly doubt a lot of people would have utilized it because they would have had to pay out of pocket for it. Right now with Medicare, this is a short term. They have not told us that we will have long-term coverage for this. It is covered currently by most insurances because we're still under a state of emergency due to COVID-19. I would say another reason to keep this around for a long time would be to lobby for it, for which the American Physical Therapy Association is. They're trying to maintain that once we are done. But I think a lot of that is going to be patient driven as well. So if this ends up going away, after the pandemic is over, I think that patients will be a big part of that to say, no, we want this as part of our healthcare. We need this as part of our healthcare. I think that for the long term for me, I love being in the clinic. I mean, I miss being in the clinic, but what a way for me to still be able to connect and help people remotely right now. And there's a huge subset of the population that need that and want that right now. And so I feel very thankful that I can still do what I love doing, but do it from home.
A second question I have is the technology interaction.
Yeah.
A lot of things that we do when we go into a doctor's office are they take your weight, they take your blood pressure, they take your heart rate. They do kind of those basic things. They ask you, if you're a senior citizen, they ask you what day it is, what date it is, and those kind of things. And it seems to me that, there's so much technology like the Apple Watch. The Apple Watch, it records your heart rate all the time. And it seems if there was a way that we could take that technology and just send that data to the healthcare provider before the Zoom session, they would have all that data in front of them and to be able to do that. And I'm wondering, is there any movement to do that at all?
I know that there, from a home care standpoint, when people are first discharged from the hospital, and for the last at least 5 or 6 years, even if not more, they do have technology now where they can deliver kind of like a pod to your house where it has a weight scale that people have to stand on, and it registers and sends it to the home care company. It has a blood pressure cuff that you can put your arm in and it'll measure it. I think you're absolutely right. And I think that, again, as we have more and more technology, our healthcare system should definitely utilize it. Even as a clinician, I have patients, I'll talk to somebody about a recent diagnosis of diabetes, and, they'll come in for a visit and they've got on their iWatch, their phone, they have an app that they've, inserted all that, and they've got their heart rate, and they've got their, they're monitoring their blood pressure at home, and, all of that is wonderful. And I do think that there are points in time where people need to physically be at the doctor. There are things that people need to palpate. They need to listen to people's hearts. There are definitely times that people can be in the office. But how many times have you went into the office where you've had your blood work done and you zip in and it's basically just a consult? Okay, stay on this medication, everything looks good, we'll see you in 6 months. Or maybe it means that if you're on a 6-month rotation with your primary doctor, that you go into there once a year and then you do a 6-month follow-up via telehealth. I definitely think that there's a lot of technology, even from a physical therapy realm. For me, working with the computer, like I have I'm using a website called MedBridge, which can give my patients a video of every single exercise that I give them. I wasn't doing that in the clinic a few months ago, so now I can send them an email. I can review all the exercises in person. I'm going to say, okay, I'm going to get off with you. And in about 10 minutes, you're going to get an email for me that outlines the exercises. And here's the pictures of the exercises that I'm going to give you. Oh, and here's an Amazon link to these cuffed weights that I think you'd be, good to have at home. It's very easy for me to give people technology. Here's a YouTube video that talks about this particular type of exercise program that I think you might be interested in. It's really easy for me at my fingertips to utilize that a lot faster in some ways than it is in the clinic. Very good question.
Hey, Melissa.
Hey.
Hi, Melissa. How are you?
I'm good. How are you?
Good, thanks. One thing I thought was interesting in the presentation, right after the COVID-19 hit us, Dr. Hartbrader's office sent out a flyer, just introducing staff and the whole thing. And they had the foresight to put telemed on there.
Mm-hmm.
And what I thought was interesting, and this is, on the medical side, not that physical therapy isn't, but of course, I've been going to Dr. Hartbrader for 20 years, so, he knows me pretty well.
Right. And
so I really had no desire to go into a waiting room and expose myself. So I set up a telemed call with him. It surprised me when I called in. I had an appointment with Dr. Hartbrader 3 hours later, which never happens in the office.
Right.
And we went over the issue. He went ahead and sent a script into our pharmacy, and bingo, it was very, very easy.
Right.
A little bit strange being on the other end of the phone or the computer with him.
Yeah.
But I'll tell you, it made it much, much easier. I felt much more at ease because I didn't have to subject myself to the waiting room.
Right.
And everything worked out fine. So, if it's something that, as you said, doesn't really involve lab work and things like that, I think it's certainly a viable option.
I've had times, like I remember last year, the very beginning of school, the first week of school, my older daughter Amelia got she had strep throat. And, 3 or 4 days later, here comes my 6-year-old with, same symptoms. I knew she had strep throat. But instead of having, that would have been a perfect example of, telehealth visit, shine a flashlight in her throat. She's got strep throat. Can you please call in an antibiotic? And instead it's 8 o'clock at night on a school night and you're trying to drag your child who's nauseated downtown to the pediatric associates, there are times where I definitely think that, that it could be utilized in a positive way, definitely.
Yeah, I had 2 questions, Melissa. I think this is a great conversation, and thank you again for doing this. When you mentioned about the copays being waived, talking about the sordid topic of coins now, is Medicare giving that to the provider, the copay as well, or is it just you lose that money but you get the monies for the visit? Because I'm just thinking about Tom's point about incentivizing the provider.
That's a really good question, and I don't know the answer to that. I know that I would assume that, whatever they would normally pay per visit, that would be given to us, as part of their reimbursement. But that is a very good question that I'm not sure about. And that's where my physical therapy hat goes out and our owners and billers, are into that realm. But I would assume so, because they, if there's a $25 copay, that is the percentage that the patient pays per visit, you know, based off of what we're in network and out of network in. So I would say that, yes, I'm sure that we get reimbursed for that.
Well, you know, if I were a healthcare provider, that's a lot of time, energy, and money to process those copays. So
Right.
they could save a whole heck of a lot more and
Yeah.
get a whole lot more. So just to,
Yeah.
again, to Tom's point,
Yeah.
you know, if you're looking at that. As well, I just wanted to share, I used to work with the UVA Medical Center, and telehealth was there. And the experience of the woman who was talking to us, who was in charge of the telehealth, this is way before COVID. She said there are some doctors that absolutely say never, never, and then when they try it, they go, "Wow, this is the best thing since sliced bread."
Yeah.
So I think there's, you know, sort of that hump to get over that everybody on this call had to get over if they never Zoomed before. It's like, well, if I want to be social, I got to do this, you know.
Right. Right. And
So
I agree. And I will say for myself, I think you know, when they asked me and approached me about doing it and trying to get it set up for the clinic, I had mixed feelings about it. I was excited to try because I'm open to trying anything. And it also gave me an option to be able to treat, you know, from home during this time. But there's definitely a learning curve to it. And, you know, if you think about it, there's a lot more talking, which I'm good at talking. So that was, you know, a lot more visual. You have to be very descriptive in how you're doing things and how you're managing things. There is the IT part of it, you know, if people aren't connecting well and that kind of thing. And again, at the very beginning, that was stressful for me as a clinician, thinking, okay, here's my appointment, and if this person isn't getting on, how do you schedule patients? You know, if it takes them 20 minutes to be able to connect, then, you know, you're on to the next patient. You have to figure out all those things. How to get, you know, how to get notes and things back and forth, how to message people who are scheduling for you. That at first I thought I would do all my own scheduling. I'm like, oh, that shouldn't be hard. Well, that lasted about 2 weeks. And then my administrative assistant, Sharon, she said, okay, well, I just thought you might wanted to try that for a couple of weeks. She knew dang well that I wasn't going to be able to do it myself. But you know, all these things that you just kind of have to tease out. So I will say that there is a steep learning curve, but now that I'm in it, I definitely am happy that I'm doing it.
anyone else, any more questions or comments?
Outstanding session, Melissa. Thanks so much for doing this. This was so helpful.
I agree. Thank you very much for the info.
Thank you.
And you are really a very venturesome lady with the way you seek and work, and also the way you consider options. You are not dogmatic about things. Thank you.
Thank you. I appreciate that.
Melissa, I do have a question though. The thing about getting in touch with Social Security, I have a backup insurance too, so I have secondary insurance, so I don't have a copay. But so would about now be the time to start contacting Social Security and saying, this is really good and this is
For
why.
advocating, yeah. I think that, and really, you know, like I said, typically in healthcare, Medicare, you know, Medicare, traditional Medicare, they're the ones that are really a lot of the driving force of what is going to be in practice. A lot of times the majority of commercial insurances will kind of follow what, you know, what Medicare does. And so, yes, if, you know, if people are wanting to advocate for this to be continued once, especially once the pandemic is completed and you know, they're in contemplation right now. So being able to contact Medicare and say, yes, I'm utilizing this and that I think it's a valid source of healthcare, which it'll be very interesting to see what happens if they take it away, you know, kind of what the backlash of that is. Because as long as this is lasting, I know for myself, I'll be advocating for it, even if, you know, after this is all said and done, I'm in the clinic a couple of days a week. You know, to be able to do this a little bit here and there on the days that I'm home, I think would be great for patients, for myself, to be able to follow up with people I'm hoping that it does continue past the pandemic.
Okay.
And oh, go ahead. Sorry.
Oh, no, I said, okay, well, you know me, I'm an advocate for things, so I'll be happy to.
Yeah, I definitely think that the more, again, I think a lot of that has to be driven by the people who are part of that insurance. And, you know, from a patient standpoint, we have a lot of people who, if they have it available and they're willing to try it and they utilize this as a resource, I think in the future, you give it a few more years. It was up and coming to start out with. You know, there were people that were utilizing it. This has just thrown it in our faces, is what it's done. And so I think that anybody who can advocate for it, I hope that it's around, you know, post-COVID. I really do.
The other thing I just want to say is that, Bruce, is that this is, Melissa kindly allowed us to record this. So if there's anyone who wants to say to their doctor, hey, here's a YouTube video I'd like you to watch, I do think this would be a really interesting thing for a provider to see and hear other people talking about the benefits of it. So, you know, we'll have that up on our website. And if anybody's interested, you can just email me and I'll let you know when it's there.
Well, thank you, Melissa. I'm going to sign off.
Okay, thank you.
I'll see you later.
Have a good one.
You
Thank
too.
you all
Bye-bye,
so
Jane.
much for coming. We appreciate it.